Oh, it's coming on again. My pain.
Okay.
I got through like 2 sentences. I'm okay, I promise. I just had to take a shower and just go take care of that pain, because what you just saw right now on camera is pretty much what I've been dealing with for like the last 5 days at that level, but what I've been dealing with since like 2018, and that's what we're gonna get into today. So if you guys have been following my Instagram lately, I've been giving you guys a little bit of updates. So kind of just to rewind a little bit, over Christmas break, well, not over Christmas break, over Christmas week or Christmas vacation, over the holidays, I went home to California, and while I was there, I had really bad cystic acne, and this cystic acne has been going on for about, January is the 5th month that it's been going on now, and this cystic acne has been the aftermath of like really, really deep and like traumatic stress and anxiety that I was dealing with like for the last few months. And if you saw my last YouTube videos, then I kind of went into depth onto like why I was dealing with those that like stress and that anxiety, lots of outside factors, dealing with like my family at home, dealing with some like work stuff, lots of change in my life over this last year, and just like kind of like feeling stuck and wanting to help people while like feeling bad, putting myself first. But we kind of finally got over that, and I've made a couple selfish decisions. I have been learning that I need to protect my peace and protect my space a little bit more. So that has been a whole journey in itself. But on top of all that, and there's honestly just so much more that goes into it, but on top of all that, while I'm in these stress cases, while I'm in like my peak stress modes where I'm just like letting the stress and the anxiety get the best of me. And what I'm talking about is like, so like for example, like over the last couple months, like I was letting the stress and anxiety get so bad. Like I'm really used to being a busy person. I'm used to having a lot on my plate. I can handle it. Like that's nothing new for me. But the last couple months, it has all gotten like the best of me, and I don't even know, because it's all so new to me. Like I didn't even know what to call it. I still don't even know what to call it, but I think what I was experiencing for the first time in my life was like actual like panic attacks and like anxiety attacks, because it could be something as simple as like someone would be like, "Hey Des, did you do this?" And then I would be like, oh my gosh. And it was just like, dude, with everything else going on, all of a sudden I'm like shaking, like my chest is getting like really hot. I'm like getting like out of breath, and then like all of a sudden I just like want to start crying because I'm just so overwhelmed. And anyone that knows me, any of my close friends, my family, I'm not a crier. I'm not an emotional person. Like if anything, like I am a true Capricorn. I am like full-blown hustle culture, and I know it's toxic and unhealthy sometimes. Look at me right now. The hustle culture sometimes can be like a lot, but that is just like the Capricorn energy in me. And when it comes to like our feelings, it's just like sometimes you just put those on the back burner and you keep trucking along, because everything comes before your feelings. Like for me, like I don't want to waste anyone's time talking about my feelings or anything like that. Like I could be the number one person that any of my sisters or my friends or anyone comes to, and I will be a listening ear. But tell me why, like as soon as I need to be that person that just needs to find a listening ear, like I can never bring myself to do that. I have a really hard time like talking about my feelings and like just putting my own needs first. I have a really hard time with that, and it's just because I'm a people pleaser, and I am the what is it called? I'm like the mender in my family. I'm like the middleman that has to bring everyone together. Like I keep my family together. Like that has always been my role. And as soon as I'm not putting that like time and attention into it, I swear all hell breaks loose. So it just like gives me like so much stress, and there is nothing that weighs heavier on my heart than when like my sisters are fighting. Sorry, I know I was just going off on like a whole tangent, but it's just because like family stuff for me is like some of the hardest, most stressful things for me, and like the things that weigh the heaviest on my heart, just because like, oh my gosh, my family and I, like we have been through so much, and like it sounds so stupid and cheesy. It just like genuinely breaks my heart when like my sisters are fighting, and then I'm put in the middle and being blamed for random stuff that I didn't even have anything to do with. And I mean, it's funny because like my sisters, like I don't think they watch my YouTube videos. Like no one watches anything I post, but it's just like As far as when it comes to your loved ones making decisions that you don't agree with, it's so hard when you are just like putting in so much effort to help someone and pull them out of like a really hard and dark time. I don't know why I'm so emotional talking about this. I think it's just like extra emotions because like I haven't talked about it in so long, and to be honest, what makes this even harder is sometimes like I just don't even know like how to talk about it because I want to talk about it. I want to bring you guys along like everything in my life, the good, the bad, the personal stuff, but it is really hard to talk about certain personal things I'm going through when it's not always like my own story to tell. So what I can tell you is that a lot of this like heavy stress that has just been like the stress that like weighs really deep on my heart, a lot of it is family related, and you know, we're getting through it. I know that you guys have questions like, well, Des, what has been so stressful? Well, you know, like, well, what's this anxiety? Like, well, what's really going on? Like, and I know you guys get like bits and parts, but it's just like, sometimes I feel like my like life and my family dynamic especially is just so hectic and complex. Sometimes I don't even want to like dive into that. But just so you guys kind of get an idea, and like, I'm so sorry, I don't know why I got so emotional earlier, but just so you guys kind of get like a better idea of like who I am and like who I am as a person and just like my heart, like I don't know why that kind of stuff, any sort of division, that kind of stuff, fighting, it just, I don't do well with it. I don't do well with it. I can't handle it. I'm just like that. I just want to believe that the world is like a fairyland and that everyone can just like get along all the time and everyone will just make smart and healthy decisions and not, you know, make decisions that will hurt other people and all that stuff. So I know that that's like a little naive of me, and I hate that I hold on to it like so strong. Like I hate that it has like such a big effect on me, but it just does. So dealing with family stuff at home, and then on top of that, you know, I was like living at my sister Jen's house, and I do this for a living. I do Instagram and YouTube and TikTok and everything, and I have my workout programs, and I have so many other projects in the works, actually, like all the time. Like I always have so many projects in the works, and it's really fun. I love being able to do this. But my sister lost her husband right after they got married. He was killed in a motorcycle accident, and then, you know, she just really needed help with the rent. So my boyfriend and I moved in with her, and we were renting a room out at her house. And I mean, there's only so much we can do with a tiny bedroom and two grown adults, and it's not like we had the master bedroom. We were sharing like a small bedroom, and like it was great. Like I loved being able to live there and help her out, and like, you know, I was paying rent like I would pay at any other apartment. I was paying her the normal amount for, you know, renting a room in California, but it just like, it was getting to the point where I felt like I couldn't do what I need and wanted to do, because it would be like little things. Like if I needed to film one day and I was taking like, if I needed to take like 4 hours to film, but you know, someone was coming home from work and I had my ring light out because my ring light just takes up so much room or whatever, like it would just cause like an issue. And I was just like, okay, it's just getting to the point where like I need to be able to have like my own space to create and work and everything like that. So all of that, just like months of stress. And then like I am a part of an influencer agency, so I have a manager who deals with like my brand deals and gives prices, because back in the day when I was doing all that, I would just, you know, take product for free and post about it because that was really exciting. And then as I've been doing this, I've been learning the ropes a little bit more. So I went on with an influencer agency, and I had a whole experience with that, and I had to let go of my old manager and then hire on a new one. And any sort of conflict and conversations like that weighs so heavy on me, and like the anxiety that I was carrying for months just dealing with that, you guys, like it was adding on and adding on. And every time I go into these like stress modes, the cystic acne comes back. And when I was heavy, back when I was 300 pounds, I had cystic acne all the time. Like it was just kind of like usual for me. And my doctor always told me that once I lost weight, that's what would clear it up. And it's just because with like having extra fat on my body, I have like extra estrogen, and it just wasn't good for my skin. So I would get cystic hormonal acne. And then of course, if you've ever had any cystic acne, you know what happens. You go to try to pop it thinking it's a pimple, and then you realize, oh, nothing happened, it's a cyst. And then it's just like this like rock hard marble underneath your skin, and there's nothing you can do about it, and you just have to wait for it to clear up. And sometimes it gets bad enough to where you don't even want to leave your house, and then like the last thing you want to do is try to cover it up with a bunch of makeup. So it's just like this really annoying thing to deal with. And so as I'm going through, after my show, I competed in summer shredding on June 20th. That was my show. I want to say that my stress, like the high levels of stress, all started pretty much after that. Like once July came around, I put off a lot of stuff during prep because I also, and I know better than anyone else that prep is a full-time job. Like it's a lot. Like it's a full commitment. And there was just a lot that I was like putting off as I was on prep. Oh, I'll get back to that after the show. Oh, I'll work on that again after the show. Like, oh, I'll just put that off. Like until then, I need to focus on the show. I'm like 1 month out. Like I'm focusing on the show. And I was just putting a lot of stuff on the back burner. And then of course, when it came time to play catch up, I never got caught up. And I still feel like I haven't been able to get caught up. And it has been eating me alive. And it just adds so much like stress and anxiety. And I mean, I could even tell you guys about how the fact I was paying rent in both California and Arizona for almost 3 months because I couldn't even find the time to pack up the bags in my room. I couldn't even find time to pack up my closet. There was 12 weeks straight that Kyle and I were traveling. And yes, of course, like I love that I get to travel. It's so much fun. It's amazing that I actually have a job where I do get to travel. It gives me the flexibility to travel for fun. But also most of the time when I do travel, it is for work, for business related things. So I am so grateful for that. But in the middle of a move, that is so hard to do. And I still haven't even gotten this apartment all the way in order yet. And when we did finally get out here, I was paying rent for almost 3 months in both Arizona and California. We finally get here, and then we were still in a nonstop travel mode. So the longest I've even been in this apartment, I've had 1 week where I was here for 12 days at a time. And then before that, the max was 6, and then the average is 4. Like, it's just been really busy, and just, I think, like, all of this stuff has just been, like, really adding on the stress. And, like, I didn't even want to like make this video to like explain why I've been stressed because I feel like there are going to be some people who watch this and they're going to be like, oh, Des is stressed because her influencer job just makes her work so much and she's so stressed, like, oh my gosh. And it's like, I just don't know how to explain my heart sometimes, and I don't know how to like explain, I don't know. I just have a hard time explaining sometimes. And the last thing I want to do is just talk about my feelings sometimes. But here we are. As you can tell, it's a little hard for me. I start to get like a little emotional. But bringing it all back. Now you know I have been stressed about a number of things. Those are some of the big things. So as I'm going through these big stressful moments, the cystic acne comes. And then what do? I think it's a pimple. So I pop it and then it would burst under the skin. And then over weeks, that burst underneath the skin, wherever it bursted, it's just taking weeks, just, you know, boiling up a storm. And then after a couple weeks, those cysts and those pimples will come to surface. And then it's just like a whole new week or two of trying to get rid of the cystic acne. And it's just like this cycle that goes on, and it is exhausting. So I was home in Ventura for Christmas, and I was staying with my boyfriend's family. We were staying at their house, and his sister, Marissa, who's also like a sister to me, she is an esthetician, and I was talking to her about my skin, and I had a cyst right here on underneath my skin, and I was like telling her how it's like getting bigger and bigger, and then like we felt it, and it started from the corner of my mouth to like where my cheekbone starts right here, and then literally into the cornea of my eye. This entire triangle like area was super red, hot, inflamed. It was like rock hard. And what she said was that it was like bacteria underneath it. So sure enough, she starts calling some of her esthetician friends. I start calling some of my esthetician friends. And then everyone's like, you need to go to the ER or the urgent care because it's in your eye. That's bacteria in the cyst and you can lose your eyesight. So I was like, oh my gosh. So I go to the ER or I go to the urgent care, and the doctor ends up like saying like he wishes he could slice my face open, but he couldn't do it there at the urgent care. So he was like gonna send me over to the hospital, to the ER to go get that done. But then after we did a little bit more like talking and he talked to another doctor, what we ended up doing was he prescribed me an antibiotic, minocycline I think it was called, and it's just like an antibiotic that would help clear my skin. And then I also got a topical one called Sulfide. I could be totally wrong. But so I have a topical and an oral antibiotic, and it luckily helped clear the cyst within like 3 days. Like it was just like going down a lot more. At least like within 1 day the color went down. So I was able to at least like you know, like walk around and like not be like super embarrassed to even be in public if I had like a huge cyst, because you could feel it under the skin, but you couldn't really see it. It was just like, it made my whole face puffy. Like you could tell this side of my face was just like puffy, and you could tell like there was just like some weird discoloration in this area, but it did start to go down, thank God. On top of that, I finally decided to tell my doctor, hey, I know that I've been, you know, having like the cystic acne like for years and everything, and the dermatologist had given me this medication like starting back in like 2017. So I've been prescribed this medication a couple times in my life. Like this one wasn't new. But I decided to finally be a big girl and tell her like, hey, I know that cystic acne also comes on from stress, and I think it's time that I tell you I'm a stress case, and I have been so stressed, and it's been to the point where I'm like crying stress, hyperventilating from stress, and I can't like, there are certain days where I'm like so overwhelmed where I don't even know how to start tackling the day. And I can't believe I just said that out loud, because if anyone that knows me just knows that that's not me. I am like the definition of a go-getter. I have had like 7 jobs at once while being a full-time student, like my entire 20s. Like I don't know how to be bored or not busy. I can balance a lot of stuff on my plate. I just have so many hobbies and passions. Like I honestly never really stop. And I just finally decided to tell her like, I think it's just like finally getting the best of me. And you know, I have some really amazing friends who are, you know, just good friends to me and will tell me all the time, Des, I think that it's really like, it could be a really good thing for you to look into therapy. My sister Heaven, she always tells me like, you need to get into therapy. And I mean, I've been told that ever since I lost my dad in high school. Like I've always been told like, you know, even though you're doing okay, Des, like you should still see a therapist, you know, or like when people hear about, you know, certain things I've gone through with my family and just all that kind of stuff, like just like my life in general before even weight loss and my weight loss journey was a thing. I've been told my whole life that I should, you know, see a therapist, and I just never have. It's not like I have anything against it. It's just one of those things, like I was telling you guys, like I don't find it productive for me to sit there and talk about my feelings. That's not going to fix the problem. Figuring out a solution is going to fix the problem. And that's just how I view it for myself. And it's so funny because I would never give that kind of advice to you or one of my sisters or one of my close friends. I would never say anything like that. It's just how I feel about myself, and I don't know why. I promise I'm working on it. But yeah, so this was like just like the first big step. So on top of getting the antibiotics, the topical and the oral, I got a referral to go see a therapist, which I'm really excited about, really nervous about, because as you can tell, I have a hard time talking about my feelings and everything like that. So I have a feeling I'm just going to be an emotional wreck. I don't even know where to begin. If she says, why are you here? I don't know what to say. I don't know where to start. I have so many answers for her. I have so many reasons. I'll tell you, I'm here for a lot of reasons, girl. Like, I don't know where to begin. So, I don't know. I'm excited. I'm nervous. I know we're on the right path. And then also, I was also prescribed an anti-anxiety medication, which I believe she said it's technically an antidepressant. I haven't started taking that yet. I'm really nervous to start the anti-anxiety. Sorry, I'm having a hard time talking. Come in. Sorry, I had to get some water, but so yeah, I haven't started the anti-anxiety medication yet. I should be getting that probably tomorrow or the next day. But after I posted about everything that I was going through over the Christmas week, you guys commented on my post and even DM'd me. So many DMs, and it was like so encouraging, and I can't believe how many of you guys told me that you too are also on an anti-anxiety or an antidepressant medication, and that it has helped you so much, even just with your productivity in your day, and just with your overall mood. And that some of you have gone through, not to be, you know, a lot of you guys have given me advice, like not to be discouraged of like the first one. I don't notice any difference, and sometimes it is kind of an experimental game and you got to try out different ones. So I was really excited to hear feedback on that, because to be honest, I am totally the type of person, like, I like to know what I'm getting myself into. That's probably why I haven't started the medication yet. Like, I need to know exactly which one I have so I can read up on it. But when it came to like my tummy tuck, I wanted to know everything about tummy tuck. So I went on YouTube, I went on Instagram, I wanted to see everyone's journeys. And I had a hard time finding anything about tummy tuck, which is why I made my series. But even with gastric bypass, I wanted to see what it was all about. So I always look for stuff like on the internet and to learn from people and sharing their stories. So thank you guys so much for anyone who reached out with a comment or a DM in regards to any of this. It is all such new territory for me. And in case you can't tell, I don't even create a lot of space to try to tackle and figure out what I'm dealing with in my head. I don't set aside time for myself like that. I am working on it. I'm learning too. That has kind of been like what I've been trying to do. Like, a lot of people are like, yeah, Des isn't as active on Instagram anymore. And it's just because it's been hard. It has been hard. I just feel like I've been going through it. I have my good days, and even on like my good days, I still have some hard moments. And on top of that, I'm going to tell you guys the pain that I've been dealing with every single day. Okay, so on top of dealing with everything I just told you guys about that, I have been dealing with a pain since 2018. Okay, so I got my gastric bypass surgery in December of 2017, like right before New Year's Eve. It was on the 29th. I spent New Year's Eve in the hospital. And I started experiencing some epigastric, means upper stomach pain. So upper stomach pain probably like around like August. So, you know, towards like after the halfway mark of like my first year post-op, I started experiencing some stomach pain, and every doctor I saw, my weight loss surgeon, everyone I saw, they all said, oh, it's the gallbladder. Most people who have gastric bypass surgery will need to get their gallbladder out, and especially because you're a woman, it's most likely that you'll have to get it removed anyways. So I remember I got my gallbladder removed May 4th, 2019, after dealing with that pain for like a good like 6 months. Finally, I got it removed in May of 2019, so I was already over a year post-op, and well, we ended up taking the gallbladder out for fun because the pain is still there. So we took out the gallbladder, and then the pain was still there, so I spent the whole year basically just trying to manage the pain. My surgeon and my doctors would just basically say like, oh, it's probably like an acid reflux. And when I was heavy, I really did have really bad heartburn and acid reflux to where I would feel it up here. But once I lost weight, like I'm talking like my first 40 pounds down, I never dealt with any acid reflux ever. Like I never felt it up here. I didn't have heartburn. It went away. Just like my doctor always told me, like once you lose weight, it's gonna go away. So I was really excited about that. But I guess what's been happening is that I still have the acid reflux problem. But since I had the gastric bypass, let me just set this down somewhere. Okay. I had the gastric bypass surgery. So my stomach has been cut, and I now have an accessory stomach, and then I have like my stomach that is used to break down the food that I eat, and it's bypassed. So like my intestines are now stitched together in a way that helps me metabolize food faster. So in my accessory stomach, and I know this sounds really weird because it's just already gonna sound really weird to you that I have two stomachs. If you aren't familiar with WLS, I have two stomachs, and that's just something that happens with gastric bypass. So in my accessory stomach, there is a whirling effect of acid. So there's just acid going around and around, eating away the lining of my accessory stomach. And because this is an accessory stomach, the food isn't going through, so that acid doesn't get food to break down, so it's just like in there whirling around, eating away the lining, making a perforation. So I essentially have like a hole in my stomach, and I can't even begin to tell you guys how bad that burns. I literally have, they said it's a perforation or an ulcer. I had to get a gastroendoscopy done. What that is you go under and they put a camera down your throat and they take pictures. So yeah, we saw a perforation or an ulcer, and from there my surgeon just prescribed me a omeprazole, which is a medication that you could buy over the counter, but I got it prescribed to me, and it kind of helps alleviate the pain, but it hasn't helped heal it. So I've just been kind of playing this manage the pain game for years, like literally years, and there's not really any answers. And I haven't really been able to talk about this online because I don't have any answers. and I don't even know where to begin. Like, I know everyone's gonna have questions. I have questions. I don't have answers. I feel like no one has answers. But you know what I finally decided to do is, while I had my doctor on the phone call, and I was like, you know what, like, while I have you here, like, we're gonna tackle the anxiety medication. We're gonna get a therapist. I'm gonna also tell you that this omeprazole is not doing it. Like, this pain that I'm in every single day, I don't know, like how long am I going to keep on popping Tums and omeprazole and drinking ginger ale? Like, I can't just keep on doing these random things that's going to help the acid in my stomach. So we have to restart the entire process of checking out what's inside my stomach, because we're going through insurance here. So even though we already know that there's an issue because we took the pictures of the gastroendoscopy back in 2020, we have to restart this entire process because all of that data is now just old. So first things first, I had to go these last 2 weeks without anything that I've been taking for the last 2 or 3 years for this pain. Any Tums, any omeprazole, anything that helps with your stomach acid, any of those medications, I've taken them all. And I have had to go 2 weeks now without them. I'm doing okay right now. I'm able to talk and I have like energy in my voice, but I have been in so much pain the last 5 days. I haven't really been able to leave this bed. I haven't been able to go to the gym. I haven't been able to walk upright to the gym because with how much pain this is causing, I'm popping so much Tylenol too. And I hate doing that. Like, I hate doing that because I can't take any Tums, but it's just like my stomach is burning so bad. It's going all the way to my back. And when I'm breathing, I can't even inhale all the way. Like, when I breathe, it's like this. And I can't really do anything. And getting ready to go talk on a video when you're in that much pain, like, I might be able to fake it till I make it for a quick second, but I'm back in bed, like, and that has just been the cycle I've been on for 2 weeks without being on any of my medication, because my doctor needs me to have all of that type of stuff, like the Tums and the omeprazole, out of my system, because when I do my blood work, we have to check for H. pylori, which is a bacteria that could, I guess, be causing the ulcer or the perforation. So we're hopefully going to be getting answers. I am just proud of myself. Can I just say that? I'm just proud of myself for finally putting on the big girl pants and being like, let's put my health first. Let's slow down and let's put my health first, and let's actually address some issues here. Right? So anyways, it's been an actual mess. I have been in crying pain the last 5 days. I haven't been able to leave this bed. I have been like so hunched from the pain that now my back is, the pain like penetrates like the back, but now it's causing, like, when I go like this, there are so many crunches. Like, I have so many knots in my back from how I've been having to sleep just to, like, not feel pain. I've been like having to do stuff like this where I have like a pillow and it's like I'm up here like this and I'm like trying to lay and just like stay like this because I'm like kind of upright, and then I'm just like trying to sleep like this. And this is how it works, and it works for like 30 minutes. And then I wake up about every 1.5 to 2 hours, like clockwork, 1.5 to 2.5 hours in so much pain. And then I'm popping my CBD gummies, I'm drinking my ginger ale, chugging water. Luckily, I have been able to have a little bit of time being in bed. I have been watching a lot of YouTube videos on people who deal with this. And I even watched some like live surgeons do work on these perforations on gastric bypass patients, because I guess it is common for gastric bypass. And it's so funny because I feel like I don't have that many resources for me being gastric bypass, because in this day and age, most people, especially my age, get the sleeve. I feel like I'm one of the only people who have bypass. So it's been a lot of learning. I like to learn through like YouTube videos and stuff. So I've been reading up on just like the procedures and stuff that I might have to be going through in order to get this fixed. I'm probably gonna have to get a surgery. I'm pretty sure that I will have to get a surgery. I saw in some cases people will have to reverse the gastric bypass to the gastric sleeve. So maybe I'll be a sleeved sister with you guys. Who knows? I have no idea what's about to come, but tomorrow I do have my blood work appointment finally. So I have to drive to California tonight for that. So yeah, blood work is tomorrow. And then I already called the doctor and I let her know that my blood work is tomorrow and that I have been this close to going to the emergency room this week. And like I said, you guys, I have a high pain tolerance. I will fight through the pain. I missed 1 day of school in high school, okay? I don't think I've ever missed a day of work. If I needed to get a shift covered, that's a different thing because I was trying to go on a trip or something, or if I was sick. But I've never just been like, oh, I don't feel good, I'm not gonna go. Like, that's just not me. It's just not me. So yeah, we're just trying to get down to the bottom of all this. I want to get it all figured out. And if I'm over here contemplating going to the emergency room, you know it's got to be bad. And the last thing I want to do is take up space in the hospital because there's already a shortage of beds in the hospitals with COVID going on. So I don't want to go to the emergency room, and I don't want to be like feeling dramatic by going to the emergency room. I just want to be able to sleep longer than an hour and a half. I want to be able to walk to the kitchen. I want to go get a workout in. Oh my gosh, it's coming on again right now. So this video was kind of long, and as you can tell, I got to record in like the little brief period where I was feeling okay, but now the pain's coming back on, so this is about the time where I gotta go and do my pain management and try to figure out what's going on, because like right now it's my stomach and my back. Do you see how like as soon as the pain comes on, I don't even know, like I have to like elongate and try to like stay upright, and it like hurts to like breathe in all the way. So okay, I'm gonna have to take a little break here, but I just want to let you guys know that this is the update. I'm so sorry it's not exactly all like positive and I don't have answers, and I have just been dreading this update because number one, I knew it would make me emotional and I don't want to be crying on YouTube anymore, and then number two, it's just like there's like so much, and I feel like I just sound like such a hot mess. Like, to be honest, this is so embarrassing, and there's probably so many of you guys watching this like, you're an idiot, put your health first. Like, what are you doing? You're 28 years old, get it together. And I get that. I need that tough love. I do need that tough love. So thank you for those people too. But yeah, that's where we're at. That's where we're at. I'm hopefully going to be getting answers very soon. This is just something that I haven't exactly wanted to put out there yet, because the last thing I want to do is instill lots of fear about gastric bypass and weight loss surgery into the minds of those who are interested in it. A majority of the messages that come to me on Instagram are people saying all they've ever wanted is to get weight loss surgery, but they're scared of this, this, and this. And those are the little things like hair loss. Girl, drink your protein, stay up on top of it, get the vitamins, and you're gonna be okay. It's just hair. Get hair extensions if you want fuller look. That's okay. But this kind of stuff, it's heavy and it's so new, and I feel like there's not really many answers. I don't really know how to go about it. I don't know how to bring you guys along this, because it's just kind of been a guessing game, and we don't know if it has anything, we honestly don't know, like, if it has to do with gastric bypass. Like, that's also the other thing, is like, maybe it doesn't even have to do with the fact that because I had weight loss surgery. It could be something completely unrelated. So I just like want to be careful about what I share, because the last thing I want to do is 50 people watching this video, you thought you wanted a gastric bypass, and now all of a sudden you're like, oh, forget that. Look what Des is dealing with. Never mind. But I also do want to be honest about my experiences, because if I am dealing with that and it's common, or maybe you would go through it if you got gastric bypass, then you should know. So do you just kind of like see like where I'm at with all this? That's where I'm at with it. But okay, it's kind of going away now. So that's the update. I know it's kind of all over the place, and I feel like there was like lots of different little things that needed to be addressed, lots of big things that needed to be addressed, and I didn't really know how to go about it, where to start. So I just decided, let's go no rules and just throw it all out there. So it's messy, it's raw, it's real, it's been hard, it's been a rough week. This has been some of the most pain I've ever been in my life. The pain that I'm in right now is by far 10 times worse than my tummy tuck recovery, my boob job recovery, my gastric bypass recovery, and my gallbladder recovery. This pain is a level 10 to 12 pain, to where I'm like, yeah, I don't know. I can't even do stuff right now. And I just need to get down to the bottom of it. So if you guys have watched this long, thank you guys so much for being here, and thank you for just giving me a place where I feel safe and comfortable sharing. I hope you guys understand how much I love and appreciate you guys. And if I didn't have this space to be able to talk about all of my struggles and all of the little mini journeys within my whole life journey, I honestly don't know what I would do without you guys. So thank you guys so much for being here. thank you for listening to all of my chaos. I just hope that I do get some answers for you guys soon. And now that I've told you guys about it, I promise I'm not gonna wait until I get some answers to like come up with an update. As I get stuff figured out, I will tell you guys like little updates here and there, especially now that I'm gonna be YouTubing more. I will be giving you guys updates here. So hang with me. If you guys have heard about anyone else going through this, message me and tell me the stories. Like, I wanna hear about it because I've seen like surgeries, but I haven't heard anyone else talk about this issue after their gastric bypass like out loud in any videos on Instagram or YouTube or anything. So if you guys have anyone who I can go learn from, please send them my way. You know, that's what I want to do. I'm freaking bedridden. So give me something to watch. Tell me what I can do. I have been working on finding new little groceries to incorporate like into like my tea, like when I'm making my ginger and lemon, just certain things that will kind of help neutralize the acid in my stomach. So any tips and tricks for that with acid reflux and like the GERD family, GERD, please let me know. This is all new territory and I'm totally open to hearing any advice. So thank you guys so much. I love you and I'll see you on the next video.